Everyone, excellent evening, everyone. Well, welcome to this evening's broadcast. How are we? And how was our weekend? I hope very restful. I hope we all rested to face a new week again. We're all welcome to this evening's broadcast. This evening we are going to be looking at throat ulcers. We're going to be looking at throat ulcers, the causes, the symptoms, preventions, and remedies for throat ulcers. Just permit me to share this on my pages so that we can get going today. Welcome. We're all welcome. Today I'm going to be answering all our questions on ulcer. So get going with your question. You can post your questions because by this time next week we'll be handling diabetes. So not that we will not I won't answer questions on ulcer, or I will, but we need to move on. We need to move on to some other things. So we'll move on to look into and be free from every form of sugar issue. Low sugar, having high sugar level, and then we will also talk about those that are anemic. Welcome. We're all welcome. So if you've joined us, you can greet. Hello, Angie, you're here. Ngozi Meke, excellent evening. How are you doing? I hope your week has been wonderful after some long weekends. And I heard it didn't rain in Lagos. It rained here today. Oh. We had rain, sweet rests in Iba for here. So who again is online? Just send your greetings so I can greet you while I just finish sharing this on my pages. Trying to do double page sharing so that it will be faster for us. We need to move on to some other things. So we'll move. You're here. Hello, Angie. Good evening. Yeah. Oh, yeah. I had a nice time, a nice evening. Nice weekend. Hello, Anne, you're welcome to this afternoon's broadcast. Welcome. I think I'm almost through with sharing, so we can get going with looking at throat ulcers today. We're going to be looking at throat ulcers today, the remedies, the causes, the prevention, looking at some home remedies you can also use. Okay, I think I'm through with sharing. All right, so welcome. Hello, Vera Chukwuezi, you're welcome. Welcome, Eteng Marian. Welcome, Fumi Adesida. Welcome, Miss Sambalogu. We're all welcome. I think I missed somebody. Welcome, Beatrice. Okay, we're all moving in all at the center. Deborah Folabi, you're welcome. Okay, let me do it in the way I'll be able to see everyone. All right, as we get going, I missed someone. I hope I get to see your name to greet you before the end of the day. Let me see. Jane, you're welcome. Welcome, Jane. Welcome, Shelly. Okay, Sherry Kate, you're welcome. Welcome to this evening's broadcast. We're looking at throat ulcers, treatments, how you can avoid throat ulcers, how you can, handle every form of throat ulcers. All right, so causes, prevention, symptoms, remedies, and things like that. I hope I see every one of us as we come in and see our questions from here. All right, so when we talk about throat ulcers, we're talking about like open sores in the throat, and this sores can also be formed in the esophagus. That is the tube that connects your throat to your stomach. That tube that connects your throat to your stomach is your esophagus, and also can also be found on your vocal cord. So when they're talking about types of ulcers or causes of ulcer, they usually use the positioning to describe it. So someone can get ulcer when an injury or an illness breaks in the lining of the throat. Hello, Pamela, you're welcome. Welcome, Monisola. Welcome, Roslyn. Welcome, Jane Destiny. Welcome, Deborah Folabi, to this afternoon's broadcast as we look at throat ulcers. So I'm trying to describe to us what throat ulcers actually is. The throat ulcers are open sores on the throat, and those sores can also be at the esophagus. It can also be on the throat and the tube connecting your throat to your stomach, and then also in your vocal cord. And then some people can also get ulcer when they have injury or illness that causes a breakage in the lining of the throat or in the mucus, when the mucous membrane breaks open and then it doesn't heal. Remember, usually when we talk about ulcer, we are talking about wounds that didn't heal fast when they are supposed to be healed, or wounds that are adamant and has refused to heal. Hello, Ngozi Arayo. Welcome to this afternoon's broadcast. Hello, Pamela. Welcome. Welcome, Florence. Welcome, Ifeoma DK. Remember, like I said, we are handling question today. I just didn't want to call it question time today. But today I'm going to spend a lot of time answering any question that I see on the screen. That's why I have my phone beside me here. So I'll see the questions as they come in and I'll answer the questions. And also, so that we'll be able to round off on ulcer. I know the month, we still have Thursday, you know. So our book on ulcer will come out on Thursday. We're going to do the book launch on Thursday. So I'm going to be telling you everything inside the book. All that we have taught will be in the book, so that you'll be able to have that book at hand in case you need to refer to it or send it to someone. You know, some people keep talking about data. Hey, they keep saying data. They don't have data to go back and watch. So at least we have the book, the handbook on ulcer beside you. So we are launching it on Thursday. Make sure you're on live on Thursday to also get some benefits that will come with it. There's going to be a goodie on Thursday that will come with it. Hello, Dufus. You're welcome to this evening's broadcast. Welcome, Mr. Joseph. Welcome, Grace Shoresim. Welcome, Owen, Juliana. Just pardon me if I don't pronounce your name very well, Joe. Pardon me. So, also, throat ulcers can become red and swollen right inside the esophagus, the vocal, voice cord, or even the throat. So, and they can also make it hard for you to eat or drink, or even chew or swallow, or even talk. I know there is one guy that has been having one kind of what do they call it? When you have your voice, you lose your voice. So he kept losing his voice until it formed an ulcer in the throat. I'm going to be talking a lot about what we should do. So if the affected tissues were swell up, they can also block the airway. The airway, the breathing airway, creating a life-threatening situation. That's why throat ulcers need to be handled and handled fast. Hello, Ife. Ifeoma Igbo, you're welcome. Welcome to this evening's broadcast. How is UK? Hope the weather is still very favorable, okay? I hope the weather is still very favorable for us. All right, so if like now you have throat ulcer and it affects the affected tissue will swell, it can now block the airway, and that will be very, very bad. All right, so many things including chemotherapy, radiation, fungal diseases, bacterial infection, fungal infection, viral infection, cancer, stomach acid reflux, and other conditions that cause irritation and inflammation can also cause throat ulcers. I'm going to be showing us or telling us how that happens. Like acid reflux that goes from your stomach right back to your mouth, that you now begin to feel that sour taste. Hello, thank you for the thumbs up. Thank you for the love. I appreciate every one of us. Welcome, Ada ABM. You're welcome to this evening's broadcast. Thank you. God bless you. Sweet too, Ada. As we look at throat ulcers. So I was saying that, many other things that can actually make one to begin to develop throat ulcer includes chemotherapy and radiation, fungal infections, bacterial infections, viral infections, some kind of cancer, people who have cancer, and then stomach reflux. Stomach acid reflux can also, cause inflammation and irritation that can bring about throat ulcer. So Ulcers may develop in the throat, on your throat. It can develop on your esophagus and then your voice box, inside, as a result of some of these conditions that I have, mentioned: bacteria, fungal, virus, chemotherapy, radiation, or some kind of cancer. So I just want to look at like 5 facts that we need to know about ulcers. 5 facts we need to know before we go into others. The treatment and management of throat ulcers will actually depend on what caused them. And that's why I keep talking about home remedy. People who go on self-medication. You need to be very, very careful. You need to be sure of what is happening to you to be able to know what to do about it. Now, some people say they are afraid. Like somebody sent me a message last week and told me what was wrong with her, and they said she should do operation, but she's afraid. She doesn't want to do the operation. She wants herbal treatment. And I say, madam, this thing you have mentioned now, no, it's better you go to the hospital. Go and do your operation. Go. The doctors are the best that can handle your situation. When you're back, we'll help you with supplements that can help you heal faster, help you get stronger faster, help you become yourself, and then help with prevention. I don't come here to tell you, yay, this supplement I have can solve all the problems in the world. I'll be deceiving you, and I won't be doing you any good. So when you have ailments, sicknesses, please make sure you know what is wrong with you. And the best way is to visit your family doctors, the hospital, so that they can ascertain what is actually wrong with you. When they tell you what is wrong with you, of course, then you can now, use home remedies. You can use supplements if that is what will help you, and then use some kind of natural means to help yourself. All right. Hello, Adefami Bolale. You're welcome to this evening's broadcast. So the pain caused by the ulcers can also lead to a range of symptoms, such as difficulties in eating, that's throat ulcer, esophageal ulcer, or voice box ulcer. It can make it difficult for you to eat, difficult for you to chew. Sometimes when you want to chew, it's quite difficult, or even swallowing, and sometimes very difficult for you to talk. Like the guy I was talking about, when he's talking now, it's very, very difficult for him to talk. So I've told you these are the facts you need to know. And then causes of throat ulcer. When we're talking about causes of throat ulcer, like I told you, it's according to the positioning. The causes of throat ulcer can be classified into 3 depending on the position of that throat ulcer. So they have ulcer found on the throat proper, and then they have ulcers that are found on the esophageal, and then they have ulcer that is found on the voice cord. All right, so those are the classes of ulcer. So now we will take the causes according to where it is positioned. That's how we will take it, according to where it's positioned. Like if one is suffering from ulcer found on the throat, then because it could be chemotherapy, radiation treatment from cancer. And that's why when people are going through chemotherapy and cancer treatment, it's good for them to have strong, nutritious, dense food, and also be on some kind of supplementation that can help boost their immunity. So because radiation actually depletes one's immunity, it actually makes one to fall ill easily. One can be treating one thing and then one is suffering from another thing. So for such people, if you're going through chemotherapy, make sure that your body is fit enough to take the chemotherapy. I know sometimes when someone is very sick, you're just looking for a fast way to get well. So as you're going through that chemotherapy, there are some, you ask your doctor, what are some of the foods that you can take that can help boost your immunity, that will not hinder what they are doing. And of course, most of those food come in good supplements, especially from our company. I have a set of supplements that we usually advise people who are going through chemotherapy to take, so one can take that. Then also infection with yeast, bacteria, or virus can also cause throat ulcer, especially the ulcer found on the throat proper. Hello, EJ Duru, you're welcome, welcome. I'm very well, EJ. How are you too? Olukemi, you're welcome to this evening's broadcast. Lucy, you're welcome. Grace Davy, you're welcome to this afternoon's broadcast. So, also some kind of cancer, like cancer of the throat, of course, can also cause throat ulcers for one. That's, you know, they call it the esophageal cancer at the back of it forms at the back of behind your mouth. That's where it forms, right inside behind the mouth, inside. Then also there's a kind of viral illness in children that can also cause throat cancer, you know. They call it hypergenia. It can also cause throat cancer. And then there's also some conditions of inflammations of the skin, you know, the lining of the mouth, the skin of the mouth, the lining. There are some people that you look at, it's like they have cells on the lining of the mouth, you know, and other parts of the body. It's also a syndrome, a kind of syndrome that can also cause throat ulcer for one. Hello, Daphne. You're welcome. Welcome, Daphne. You're welcome to this evening's broadcast. Thank you for joining us once again. Then we have ulcer of the throat. Another causes of ulcer of the throat when it's in the vocal, when it is in the voice cord. Hello, am I still online? Yes. How come this one left? So when it's on the voice cord, then it can actually also cause some kind of ulcer. So they call it ulcer found in the voice cord. And the things that causes is irritation from excess talking or singing, like the guy I was telling us about. What caused his throat ulcer was excessive talking. You know, he was working in a place where he had to talk from morning till night, you know. And then people who sing, those who sing. And that's why if you sing, it's better for you to keep giving your throat what it needs. And one of the best food for your throat, if you're singing or if you're talking too much, is honey, natural honey. In fact, anytime my husband has recording, he will ask me, go and bring your forever honey. If he's finishing, you know, he will put a lot inside warm water and then he will take it. But be careful. If you are diabetic, reduce the quantity of honey you take. But if you're not diabetic and you need to sing a lot or talk a lot, make sure you make honey part of your food. You know, it's it's a good food for the throat. And generally for ulcers, honey is very, very good because it also helps to hinder and also to reduce H. pylori. That's ulcer causing bacteria that could be in the stomach and other parts of the body. So again, another thing that would cause voice cord ulcer is gastric reflux. When you have gastric reflux, or if you have repeated upper respiratory infection, there are some people who have bronchitis and all this upper respiratory infection frequently. If it's repeated frequently, it can cause throat or voice cord ulcer. So one has to be very, very careful to prevent and treat such issues. And then when there's an endotracheal tube placed in your throat, you know, for people who need it for breathing during surgery, it can also cause ulcers. Because some people, when they are placing their tube, it can cause one or a little injury that might be infected. So if you've gone through operation or you're just coming out and they needed to put the endotracheal tube, you need to actually make sure that you boost your immunity and make sure you take your forever honey and then you take your Pro B so that you're sure you're okay, you know. Hello, welcome to this evening's broadcast. Lucy, you're welcome. All right, so the third one, which is ulcer found in the esophagus, is the third grouping, and we are looking at the causes of ulcer at this period. And we are saying for the, of course, esophagus is the main issue that causes the ulcer of the esophagus is acid reflux. You know, they call it the gastroesophageal reflux disease. You know, it's actually a backflow of acid from your stomach into your esophageal on a regular basis, not just when it happens only once, so that people will not begin to be afraid for nothing. But when it's regular, and that's why if you're having acid reflux coming from your stomach, you need to handle it fast. Please, let's take care of our bodies. Let's take care of our bodies. Let's not keep procrastinating when we start seeing changes in our body, changes in our system. Let's stop procrastinating. Let's handle it immediately. Like this acid reflux. If immediately you start having acid reflux, make sure you stop it. Go down my page. I've done a lot of teachings on acid reflux, even exercises you can do if you're having acid reflux. I've also taught you about the food you should avoid and the food you should take. All right. So also, if one of the causes of esophageal ulcer is also an infection on your esophagus caused by virus such as herpes simplex, and some other viruses that can cause it. Then irritation from alcohol and certain medicines can also cause esophageal ulcers. When you're taking, like I've always told us, non-steroidal medications, they can also cause esophageal ulcers. And then alcohol, beer, all those ones can also cause esophageal ulcer. Then, of course, I've already said it, chemotherapy and radiation from cancer. And then another thing, which, happens to common people that they don't take care of, is excessive vomiting. When you start vomiting excessively, please make sure you handle the vomit. Of course, you know that there are some therapies you can use to quell vomit anytime you feel like if you're vomiting excessively. There are some therapies you can also use to quell them. So if you're vomiting, handle the vomit. So these are the causes of the different groups, the 3 groups of throat ulcer: the throat ulcer itself, the voice cord ulcer, and the esophageal ulcer. So let's just look at the symptoms before we look at the remedies. Remember, I said today is question time. I'm actually being fast so that I'll be able to answer our questions very well. So drop in your questions. Let me see your questions and answer. So symptoms of throat ulcer includes a sore throat. You will have sore throat. That's one of the commonest symptoms. And then one will be feeling as if there's something inside your throat. Each time you'll be trying to swallow, feeling there's something inside your throat. So you'll be trying to, each time you feel, what is this thing inside my throat? So you feel a lump on your throat. And then, of course, difficulties in swallowing things, pain when you're swallowing things. You can also feel nauseatic. Also, fever and chills can come. Remember, you don't have to have all the symptoms, but when you have some of these symptoms, you need to check to find out if you're okay and what is happening to you. Then you will have stomach acid regurgitation if you're having throat ulcers. You will just, as if the things in your stomach wants to come out of your stomach. Then, of course, chest pain and burning on this pain, heartburn. That's what we call heartburn. And then it can also cause joint pains. I was just discussing with somebody, and the person was saying, that it was having arthritis. Arthritis near the bone of the joints and the rest. Yet it was not arthritis happening to the person. It was ulcer, and the symptom was appearing as if it's arthritis. And that brings me back to the fact that you need to be sure what is happening to you. Hello, Oluchi Ejaka, you're welcome. You're welcome to today's broadcast, okay? So today we are looking at ulcers, the causes, the infection, the symptoms, and all the things that you need to know about ulcers. And I also said that today is question time, so you can ask your question. Oluchi is asking, what's the cause for PID? That's pelvic inflammatory disease. The cause for pelvic inflammatory disease. So it's an infection of the female reproductive organ, and it most often occurs when there is a sexual transmitted, bacteria spread from the female's vagina or the uterus or fallopian tubes or the ovaries. So it's when there is infection from these organs So that's what causes the PID, the pelvic inflammatory disease. Okay, I hope I've answered your question. And then Oluchi is asking, is movement in the stomach part of ulcer? It depends on what the movement is. So Oluchi, depends on what the movement is. That's what will determine whether it's ulcer or not. But I've already told us some of the symptoms of ulcer. You know, you can go down and watch that paste if it's like stomach ulcer, gastric ulcers that you're having. So some movements could be because it's ulcer, some could just be irritation in the stomach, and some can actually be lower abdomen. It might not actually be inside your stomach. So you need to know which part of your stomach is having it. So well, if your voice is not clear when talking, it depends. I don't understand that question, Mr. Joseph. Is it maybe that you've had sore throat, or you've had what do they call this thing? You lost your voice and it's no more clear. Is that what you're asking? I need to understand the question very well. You know, I need to understand it. Okay, so if you explain, then I'll be able to answer you well, so I can answer the correct thing. Good evening, Emmanuel, Remy, Olukemi. You're welcome to this evening's broadcast. So we are looking at throat ulcers, and then we are also handling question. Okay, so Joseph said when you have you lose your voice, and then your voice is not getting clear. It's because the voice cord is still stressed. So you need to take, like I told us, honey, some warm things, and then you also need to be sure that the symptoms and your immune system has cleared. You can also take your Pro B so that you'll be able to relax the voice. And there are some other remedies that you need. You need to relax that voice. You need to take warm things, like I said, to be able to help you. And you need to reduce your stress on talking. Reduce talking and allow your voice cord to rest so that you will actually heal. So when the voice still remains cracked, still remains not clear, not talking well, is because the voice cord is still affected. And remember, if you allow that voice cord to be stressed much, it can begin to cause some kind of ulcers. All right, so another symptom of throat ulcers, remember the 3 types of ulcer: voice box, throat, or esophageal. I'm treating the symptoms all together. You know, when the ulcer have stayed for long and then it has bruised much, it can one will begin to vomit. It could be just, you know, irritant, making one to feel like vomiting, or the person can also vomit blood with it. And then there will be this kind of choking sensation as if, you know, the person is being choked most times. And of course, like I was answering Adetunji, voice change. If one is having persistent voice change, you know, changes in your voice, you need to go and check out. Just go to the hospital so they can do some kind of x-ray and test to check your voice box. Then frequent coughing and clearing of the throat. Every time you see the person do you know, that means there's an issue. It could be already that the person has an ulcer. And you know, sometimes ulcers come without pain. And that's one thing bad with many sicknesses that don't come with pain. It's not really very good. And that's why one needs medical checkup. At this age, at middle age, you need to check your body. If you're already 50, 60 years, maybe every 6 months, every year at least. Then if you're like 35 years and above, every 2 years, until you hit your 45, 50, then you have to be checking yourself every year so that you'll be sure you're okay. It's very, very important for us to do so. Emanuela is asking if when someone is releasing gas as in polluting often, is it sign of ulcer? It could be sign of constipation. It could be sign of irritated stomach. It could be sign of bad diet. It could be sign of ulcer. It could be sign of acid reflux. So, you know, you cannot just pin it down on ulcer alone. I've mentioned 5 things that could be causing one to gas and want to pollute the air. So poor diet, very bad diet, will cause one to be polluting. And then if one is taking too much vegetables without having enough fiber, you know, such vegetables that are hollow, without having enough fiber to push the vegetable, it can cause some kind of gas, you know, in the system. And then ulcer can be part of it, constipation can be part of it, acid reflux can be part of it. All right. Oluchi Ejiaka is asking the natural things you can use for hormonal imbalance without drugs. Is your food, but it's very, very difficult, I must tell you, because you need to actually hire a dietitian to be able to tell you the quantity of such vegetables you're supposed to take. The timing, the cooking system is also there, so that you'll be able to have enough to balance your hormone. And then you need to also know the readings of your hormone. What's the reading for your estrogen, your progesterone, for your testosterone, for the men and the rest, you know that. You need to know the readings before you'll be able to say, okay, this and this and these are the food I need. But generally speaking, vegetables are very, very good for hormonal balancing. And berries are very, very good for hormonal balancing. That's the berries, you know, all the types of berries. But I say, you know, if you don't want to take drugs, take food supplements. Because food supplements are actually food in capsules. That's what they are called. They are food that has been extracted for you in the quantity that you need them, and they are put inside capsule so that you'll be able to get enough. Like I was discussing with someone, I think it was today. Was it early this morning? Yes, it was early this morning. She's in Paris, and she needed some supplements to balance her hormone because she was having issues. When she described, I told her what it was. And I said, you know, you won't be able to find all this in your food. You won't be able to cook it the way it's supposed to be cooked for you to get enough. So get food supplements. It has helped a number of people. Get good supplement. And for hormonal balance, I might just tell you, Emanuela, I think, okay, Oluchi is the one that asked the question. Forever Vitalize Women is very, very good. Bee pollen is very, very good to balance your immune, and they are natural, 100% natural, no addictive. In fact, I've gone to where they are making the bee pollen, and they just got the pollen of the bee, and they just used honey, this honey, the natural honey, you know, to mix it up into a tablet. Nothing more was added. So when you have such companies where you can get such beautiful supplements, I advise you that you take it. All right, so we've talked about frequent coughing or clearing of throat, and then change of taste. When you begin to have taste change, like your taste in your mouth will be acidic, bitter, sour in your mouth, it could be that you have throat ulcer. You need to watch it. When you have acidic taste, when you have frequent bitter taste, when you have frequent sour taste in your mouth, it could be that you have throat ulcer. You need to watch it. And then smelling. Your smelling will change. The smell you perceive will change. And then sometimes it will cause ear pain. Because remember, your ear, your throat, and your nose, they are actually connected. That's why they call them the ENT. ENT, ear, nose, and throat. So they are actually connected. So you can have ear pain if you're having throat ulcer. It's also part of the symptom. Udwak, see you. Udwak, eh? Oh my goodness, Udwak, you're such a very funny person. Thank God you have made me happy. She said I have just received my supplements. Udwak. Udwak, Kenam. All right, thank you for telling me here on Facebook. Or have you chatted me on WhatsApp and I didn't look at it? Udwak was one of those that woke me up with. Was it not even 4 a.m. Seth, Udwak? Oh my goodness. Hey, that she has not received a supplement. She needs a supplement. This one and that one. Okay, thank you. Thank God you have received it. Ah, wow. Magna Adamson connecting from Jamaica. God bless you. Thank you for joining us. Thank you. Welcome, Odwak. Then Grace Gifty, you're welcome. God bless you too. Good evening, Obia Nuju. God bless you. Esther Mark, good evening. Oh, it's Esther Mark's first time for joining us online. Let's welcome Esther Mark to this evening's broadcast and welcome her to Aging with Grace page. You're welcome, welcome, Esther Mark. This is Aging with Grace. It's a page for middle-aged men and women, you know, where we talk about products, natural things that can help you stay healthy and stay away from hospital and make you look younger, age gracefully, age happily, age, you know, enjoying your life. And my name is Ngozi Achonwa. Welcome, Grace Mark, for joining us today. All right, Obianuju. Obianuju said my smile is infectious. She's smiling along. Thank you, Obianuju. Thank you for thanking me. God bless you too. You know, it's good. There's our company says something. You know, I belong to Forever Living Company, and we have an ad date. If it doesn't make you smile, stop it. Change it. If it doesn't make you smile. Thank you for the thumbs up. Thank you for the love. So anything that doesn't make you smile, please change it, because you need to keep smiling. I enjoy what I'm doing. I enjoy helping people. I enjoy people being in health and prospering even as their soul prospers. That's what I really love. I love people to have complete health, physical, social, financial health, and most especially spiritual health. I want you to be in health and prosper even as your soul prospers, okay? So those are the symptoms. Those are the symptoms. I hope I don't have any question I need to look at. Oluchi say, when can I get the B-pollen drug, ma? It's not a drug, it's a supplement. It's B-pollen. Okay, I don't have B-pollen. Please, can they give me B-pollen? It's on my table. It's just on my table there. B-pollen, I sell it. Oluchi, I sell it and I take it every day because it's very, very good for hormonal balancing. It's very, very good. The other table, the side table, it's very, very good for hormonal balancing. It's very, very good for those middle-aged people for menopausal issue. It's very, very good for metabolism. It helps give you energy, stamina, and metabolism and melts away fat, you know. So I take it every day. All right. So we're going into prevention. So Obianuju, chat me on my number on the screen, +234 703 515 1642. +234 703 515 1642. They will soon put it in on the screen for you so that you'll be able to get your B-pollen, and it's very, very affordable. There was a time I did a promo for it, but it's no more on promo. B-pollen is no more on promo, but there was a time I did promo. So this is B-pollen. Oluchi, you're asking. This is B-pollen, not B-pollen. Let me show it very well. It's B-pollen. Okay. All right, so I take it every day like I tell us. This is my open bottle. They just got it from my table. So I chew like, we can chew between like 3 to even 8 a day. So this is 3 now. I love chewing it. It's very, very nice. It's very, very nice. B-pollen. Okay, so no, you can't. It's not a drug. It's a supplement, and you don't get it in the pharmacy. Hello, Sherifat. You're welcome, Sherifat. Thank you. Olu Fumilayo, you're welcome. Oh, Olu Ojo, is your first time. Wow, let's welcome Olu Ojo. It's her first time. Let's welcome her to this evening's broadcast. Well, Emmanuel Remy is asking, what are the natural remedy for one that is always clearing throat and sometimes throat mucus? We're going to be handling the remedies very soon, so you're going to see it. Oluchi, I don't give my price on Facebook. Oh, chat me on WhatsApp, okay? The number should be on the screen and pinned now. Shall you help me? Oh, Sharifa says she's enjoying her Pro B. Thank you for thanking me. Pro B is fantastic, I tell you. Anybody that has any form of ulcer, this is the #1 product you need to be out of ulcer. Pro B is fantastic. You know, whether it's throat ulcer, stomach ulcer, esophageal ulcer, duodenum ulcer, colon ulcer, whatever ulcer you're having, Pro B is fantastic. Thank you for saying so, Sherifat. Okay, so prevention. You might not be able to prevent some causes of throat ulcers and throat sore, such as if one is going through cancer treatment. You might not be able to, prevent it, but at least you can help reducing its coming like I said, by increasing your immunity. But some other causes are very, very preventable, you know. So we're going to go through some of the preventions now. Oh, Irene Maintain says her first time. Please, let's welcome Irene to Aging with Grace page. Like I said, is a one-stop page for you to learn how natural remedies on how you can stay healthy and stay away from the hospital, age gracefully, and make sure your stamina is okay, you're growing well, you know, you're happy. All right. So the first prevention that you need is to maintain good hygiene. You need to maintain good hygiene by washing your hands often throughout the day. If you go out and come back, wash your hands. You know, when you stay a bit, if you enter the toilet and come and make it a habit. Make it a habit of washing your hands when you enter the toilet. Sorry, my phone. Somebody is calling me. It doesn't know I'm online. So when you enter the toilet, you need to wash your hands. Make it a habit. Even if you're just urinating, you went to urinate. Make it a habit to always take your soap and let it be liquid soap, please, that you put in your toilet. Liquid soap, use it to wash your hands and let it be under running water, because hygiene is very, very important, especially also before you eat. Please, before you eat, don't rush your food. Go and get water and wash your hands very well, you know. And then anytime you use the bathroom, like I say, wash your hands. Then stay away from people who are sick. When you go to visit people who are sick, yes, at that moment, love them from afar, talk with them from afar. You know, when people have cough, catarrh, and the rest, it's not as if you should be doing to people, but stay away, because it's not just all about you. You know, like during COVID-19, when it was very, very, you know, some people were carriers. They were carriers. They have strong immunity, but they will not carry and transfer to people who don't have strong one. So you need to keep, you know, safe, and then get all your vaccination. Please make sure you get all your vaccinations. You know, my phone was ringing and some people got buffed up. I hope nobody asked a question. Millie Stabel, welcome. Thank you for thanking me also. Irene Maintain, you're welcome. Abiodu Janet, thank you for thanking me. Wow, Kate is watching from Dallas. You're welcome, Kate, from Dallas. Welcome to every one of us. So I've talked about being hygiene. I've talked about washing your hands. I've talked about taking your vaccines very well. And then exercise and eat healthy. Exercising and eating healthy can help you very, very well, you know, to stay away from diseases and all kinds of ulcer. Especially also to prevent gastroesophageal reflux disease. You need to exercise very well. Stick to a healthy diet and also maintain a good weight. Because when you add weight, you know, the weight will press, your excess weight and extra weight will press on your stomach and then force the acid up into your esophagus. So excess weight is not very good. Excess weight can cause a lot of acid reflux. And then if you're having excess weight and you're having acid reflux, you can go down and watch my video that I did on acid reflux. You know, one of the things you need to do is to reduce heavy meals and start eating small meals. You can eat small meals per day. And again, make sure you take your supplements, take your Pro B, very, very good. Stay on your B pollen, very good. Your Fields of Green, very good for you at this period. And then your aloe vera gel. In fact, if you're having acid reflux and it's disturbing you, aloe vera gel is one thing you can just take, maybe like half a glass or quarter of a glass, and take it, and you know, it will help to push down and normalize your system very well. So then another preventive measure is to adjust your medication if necessary. Always ask your doctor about the medicines they give you. Don't be shy. Even in Nigeria here, where you know that they don't want to always be telling you about your medications, ask them. Especially the doctors. Don't wait till you get to the nurse. When the doctor is prescribing, you could just ask, so doctor, what are you giving me for this? When he tells you, say, please sir, what are some of the side effects? Ask. Always ask them, what are some of the side effects? So if like it has some side effects that can, and you tell the doctor other things, that's why they ask for your history. Don't go there and just say, because your head is the only thing aching you, you will go there, you just be talking about head, and now forgetting that you have other issues. You know, you need to talk so that, and the doctor will know, okay, do I reduce this medicine, the dosage, or do I change the dosage or whatever for you, or switch the medicine for you. Ngozi is still asking the same question. Ngozi, were you not here? We've answered this question. She's still asking, is polluting always sign of ulcer? No, polluting is not always sign of ulcer, ma. Polluting can be because of constipation. Polluting can be because of acid reflux. It can be also because of overfeeding. It can also be because of the type of food that you have eaten. You know, so many things can cause. So polluting is not just ulcer that causes it. Then another preventive measure you need is not stop smoking if you smoke, because smoking increases your risk for cancer, and this can also contribute to throat ulcer. Remember that cancers can also cause throat ulcer. Then smoking also irritates your throat and weakens the valve that keeps acid from breaking up into your esophagus. So, of course, I'm sure people here, Aging with Grace fans, don't smoke, so we don't have to talk so much about it. Then also prevent or manage acid reflux. This is very, very important. It's one of the issues that would cause sore throat and ulcer of the throat that you can manage. Remember that I said if it's cancer, you know, one might not, but acid reflux is one that you can, you know, manage. So maintain a healthy weight. I've talked about it. If you need to lose weight, please lose weight. It's very, very important. Of course, I talked on, I think it was on Saturday that I talked about this, and I said weight loss. If you don't lose weight, if you gain weight and you overweight or you obese, it can cause a lot of diseases. Many people, let me tell you, when you just lose weight, you will become well. If you're having high blood pressure, if you're having ulcers, if you're having issues with diabetes, sometimes when you just lose weight, you find out that you're 90% well. So please maintain a healthy weight, avoid acid or food that triggers, you know, acid, avoid large quantity of meal, avoid fatty food. Go and watch that my video. Let's not go over it again. All right, Ngozi is saying, I always notice that when I eat beans. Okay, yes, some people, that's why I'm saying some kind of foods that can cause acid reflux or heartburn for you, you need to prevent it. But I tell you, there are ways you can cook beans that it will not cause heartburn. I cook beans and I don't have heartburn. People who eat my beans, they don't have heartburn. Go down my page, down, put it, sweet beans, you will find how to do it. Then of course, if you're having acid reflux frequently, before you lose that weight, before you're okay, you need to elevate your head on the bed with, you know, risers. They have some kind of these risers that they also sell that are in foam-like form that you can use. And of course, use your anti-reflux supplements, which are Pro B, Fields of Green, and aloe vera gel. Pro B, Fields of Green, and aloe vera gel. And then for throat ulcers also, you find out some people that is when they have that kind of mouth issues that they can have throat ulcer. So I always advise people to wash their mouth with tooth gel that has propolis, tooth gel that has saponin, that can do natural cleansing, and Forever Tooth Gel is one of them. Forever Tooth Gel has saponin, it has propolis, it has stabilized aloe vera gel that can help cleanse your mouth and keep you away from mouth ulcer. I'm going to tell you a story about this. Thank you for the thumbs up, thank you for the love, I appreciate. Normal size for what though? Oluchi, normal size for what? I don't understand that your question. Normal size for what? Explain. Now I want to tell you a story about this bright tooth gel. In our local church, one of the days they had youths. The youths were having youth day, so they performed a lot. And that day, I just received I should go with some of my products to go and give the youth. So I took some tooth gel, some Shield deodorant, some aloe vera soap, some avocado soap, some lip balm, you know, our aloe lip balm, that miracle stick. So I took some of them. So when they called me to pray for the youth, I just said all of them should, when they came to the front, I asked them for my bag. You know, I took plenty of these products. I started giving all the youths. I would just dip my hand and give, dip my hand and give. So there was one guy that came to church for the first time that day in the church, and I gave him, he received this tooth gel from me. So I wasn't in that church, in the local church. I went to another church the next Sunday, and everybody was calling me after service. They said, now mommy, that there is a testimony in church today, that one of the guy that came to church for the first time, that he came back. He said he's coming to give this testimony. He wasn't residing in Ibafo. He just came around to do some work and came to church that day and received this gift. So he said he was giving testimony. He said he had had mouth sore. He had had mouth ulcer for a long time, and he's been using so many medicine to treat it. So that somebody recommended this tooth gel for him then, but he couldn't afford it. So that when he came to church and I gave him this, he said, God, is this what you brought me here for? Because he was still having that ulcer. And he had used this tooth gel for like that 3-4 days, and he noticed changes. So he just told himself he was coming back. He went all the way from where he was staying to come back to give the testimony. So keep healthy. Like I said, get very good tooth gel. This tooth gel is very, very good. It can heal mouth sores. It can heal bleeding. It can actually keep you away from, going from all dental issue to the other. At least that's my own testimony. I've given it. I don't want to give that testimony again today. All right. So, Oluchi, I'm still waiting for normal size of what you're asking. So, remedies for throat ulcer. I've already told us some of the remedies. I've told us the prevention. And then we are looking at the remedies now. Lifestyle changes and modification that you need to make that could manage the symptoms are: 1, avoid acidic or spicy food. Now, when you're not feeling fine, it's better for you to stay like somebody who is managing an issue. I love pepper a lot. I tell you, I love spicy food a lot. But there are some people like me. If you're having throat ulcer or esophageal ulcer or voice box ulcer at that period, please step down on spicy food. And then you need to use mouthwash. And then also stop mouthwash that can actually help to cleanse your system very well. Like I said, avoid alcohol, avoid smoking, and that's why I talked about bright tooth gel. Bright tooth gel can be a mouthwash. It can be your tooth gel. You can just put some in your mouth, Google it in your mouth. Even if you swallow it, there's nothing wrong with it because it's all from natural source. Everything is natural. It's not like chemicals that were used for it. So some other remedies that you need, lifestyle changes: avoid rough and hard food such as chips, nuts, some kind of hard fruits and hard vegetables. You need to avoid them, okay? And then some other remedies that you also need is rinsing your mouth or gargling with a mixture of water, salt, and baking soda. You put water, salt, and baking soda in warm water, very lukewarm water. You gargle your mouth, but please don't swallow it. Gargle it in your mouth, and then you spit it out. Then you need to stop eating very hot food. If you're having ulcers of the mouth, you need to stop eating very hot food. Okay? You need to start eating very hot food, and then eat food that are lukewarm, cold food, then frozen. If you're having ulcers, ulcer of the throat, you can take frozen fruits or like ice pops. All those ice pops can also help you. And then you also need to stay hydrated. You need to drink plenty water and plenty liquid throughout the day. You need to drink plenty water and plenty liquid throughout the day. Then other remedies that you need is reducing risk of gastroesophageal reflux disease, like I said, and by maintaining good weight, avoiding foods, irritable foods, like tomato-based foods, citrus, mint, and chocolate. If you're having ulcers, stay away from tomato-based food. Stay away from citrus fruits. There are other fruits you can take. Stay away from mint, like all this peppermint tea and mint. Sometimes when people are having gastric ulcers, they will go and take peppermint. It will only cool you for 3 minutes or for a few minutes, and then it will gravitate. So you need to be very, very careful. And then you need to, if you're having ulcers, avoid eating large fatty meals. especially before bed. Hello, Eno Eti, you're welcome. Eno, how are you? Kate, Ori, you're welcome. Welcome to this evening's broadcast. We are looking at throat ulcers, prevention, symptoms, treatments, remedies, causes, and the rest. So we've gone a long while. You can go ahead and watch the replay. Somebody is asking, please, where can I get the toothpaste to buy? Irene, chat me on my WhatsApp. I sell the toothpaste. I sell Forever Tooth Gel. I sell it. So chat me on my WhatsApp and I'll tell you how you can get your tooth gel. Okay? My number is on the screen and it's pinned on the screen. Oluchi is asking, she said, what are the normal size of weight in human? It depends on your height, your age. You know, that's what depends. So Oluchi, I can help you calculate your BMI. Chat me on my WhatsApp number, Oluchi, and give me your age, your height, and your present weight, and I'll help you calculate your BMI. There's no weight that is normal weight. It's different from individual to individual. Okay, all right. Ngozi, what are you saying? You said fat. Yes, yes. When you're fatting, it's not necessarily because you have ulcer. Ngozi, I answered that question. When you're fatting, it doesn't necessarily mean it's ulcer. One can, in fact, you even need to fat self. Fat is a natural fatting. That's polluting the air that people call it. It's natural. Sometimes you need to fat. You need to fat now. But, you know, it's when it's excessive that one now begins to look at what causes it. Oluchi, don't worry. Chat me on my WhatsApp. Don't tell us your weight and height and 100 kg looks much, Oluchi, but then chat me on WhatsApp. Let me see your height. If I get your height and your age, I'll be able to calculate your BMI and then also tell you what your calorie deficit should be. I will do it for you free because you asked for it here. But usually people pay to enter my page where I do it. All right, so I think I've answered all the questions we have today. So I'll briefly just run through some of the headlines of some of the things we did before we call it a day. We have just like 3 minutes to go. So today in Aging with Grace, we looked at, remember, Aging with Grace. My name is Ngozi Achonwa, and I teach you how you stay away from hospital using natural things you find around you, exercises, diets, remedies, food supplements, lifestyle changes that you can use to stay away from hospital and be healthy. So today we looked at throat ulcer causes, symptoms, prevention, and their remedies. And I said that throat ulcers are open sores in the throat. And remember when I talked about the types of throat ulcers that you can have, I told you that it depends on the position. It's the position that determines which type of, you know, the causes and also determines the types. So I said ulcer found on the throat proper, ulcer found on the esophagus, and also ulcer found on the voice cord. These are some of the places where you can find them. And I also described all of them for you. And I then talked about the symptoms, running through the symptoms: sore throat, feeling of having a lump on your throat, difficulties in swallowing things, pain in swallowing. You can feel nauseatic, fever, chill, stomach, or acid regurgitation, chest pain, that's heartburn, you know, or some kind of chest pain and joint pain. You can also vomit, whether it's vomiting blood or not blood, choking sensation, frequent coughing or clearing of the throat. Adana, all right, no problem. She said I should also help her check her own. All right, just chat me on WhatsApp. All right, Oji, Taju, you send me message on WhatsApp. I'll check it out, no problem. And then I also talked about taste changes. Could also be some of the symptoms of throat ulcer. Then ear pain. And remember, ear and teeth connected together. And then we talked about prevention, what you're supposed to do. Maintain good hygiene, washing your hands all the time. Take all your vaccinations. Excessive weight, reduce excessive weight. Avoid eating large meals at the same time. And then take your supplements, you know, and ask your doctors about your medications. Don't smoke. We also looked at preventing and managing acid reflux, because acid reflux can actually cause throat ulcer. Okay, hello Buki Kayode, you're welcome. welcome, welcome, welcome. And then we talked about remedies, lifestyle changes that you need. Avoid spicy, acidic food. And then use your mouthwash. Use good tooth gel. That is very, very good for you, like forever aloe vera gel. Very, very good for you. So use it. And then we should avoid some kind of food, like hard foods like chips, nuts, and some kind of hard fruits and vegetables. And then I also talked about rinsing and gargling with a mixture of water, salt, and baking soda, but please don't drink it. Please don't swallow it. You know, and then we talked about taking frozen foods instead of hot food. No, taking lukewarm food and cold foods instead of hot food, okay? And then we also talked about taking sour milk before each meal. Like you can eat a sour cream before each meal so that it can coat your mucous membrane. So you need to take some sour cream food so that it can coat your mucous membrane before you eat. You know, that can also help. And then very important, staying hydrated. Drink small amount of liquid throughout the day, and water is the best liquid for you. Water is the best liquid that you can ever have, okay? It's 6 o'clock. Thank you for joining me this evening. Thank you, thank you, thank you, thank you, thank you, thank you. Just chat me on WhatsApp. My number is on the screen. If you need more questions, I'll be able to answer your questions. And if you need me to calculate your BMI, I might not be able to do it fast, but I will still do it for you before this time tomorrow. You will get it. All right, thank you for joining me today. I love you all. Continue being fans of Aging with Grace and keep sharing with people. Let me give us one assignment. Now, let me see somebody who will share this video with 5 people. Let me see somebody who will share this video with 5 people. And those 5 people will join us on Thursday. I will have a gift for you. 5 people to share this video right now to their friends, to the groups they belong. And let 5 people join us on Thursday saying that they joined because you shared it with them. And you get a gift for me. Love you. Bye.